All right, kidneys and GI. First, the renal system. Sometimes the fetus voids or the infant voids right at birth. We do want to see them voiding within 24 hours of birth. If they have not voided within 24 hours, that needs to be reported for assessment. They have a limited ability to concentrate urine. So babies tend to get dehydrated more easily because even if they're dehydrated, they still keep losing water in the urine. Sometimes in the first day or two, there's this brick dust looking substance in the diaper. That's uric acid crystals. And that's a variation of normal. It's not uncommon. Newborns also have increased extracellular fluid volume. So they have a higher water content than older children and adults. Now, the GI system, sucking and swallowing in newborns are reflexive. Preterm infants may have a hard time coordinating that. So they have a sucking reflex, a swallowing reflex, and in the day or so after birth, they're learning to coordinate those things, to suck and swallow and breathe in coordination. Preterm infants have a harder time with that. They may have a harder time, and so that it takes them more energy to feed, and also they need more. So preterm infants feeding can be a challenge. Teeth develop in utero, but they usually don't erupt until late infancy. If a newborn is born with teeth, those are called natal teeth. Usually it's a completely separate tooth. They still have a baby tooth and a permanent tooth in that spot. And those are usually removed because there's a risk of aspiration in infancy if they should become loose. The mucus barrier in the gut is immature until about 4 to 6 months of age. And that means antigens can cross and bacteria can cross, which means there's an increased risk of allergies and an increased risk of infections. The gastrointestinal microbiome is established by those first feedings. Before the first feeding, the gut is basically sterile. And so the first feeding actually helps establish normal gut bacteria. That's when we begin to, the newborn can begin to synthesize vitamin K, folate, and biotin. The newborn microbiome may be affected by the method of birth and their feeding. There have been studies that show the microbiome is different for babies born by C-section versus vaginally, and for babies that are breastfed versus formula fed. The esophageal sphincter in newborns is immature, and so that means when their tummies are full, when the stomach is full, they'll reflux some, or they'll spit up some formula. Spitting up is normal. Pain is not. If a baby seems to be crying in pain with spitting up, it needs to be evaluated. If they're not gaining weight and spitting up a lot, it needs to be evaluated. But other than that, spitting up is normal. Digestion, newborns can digest simple carbohydrates and proteins. They have a limited ability to digest fats. Human milk actually contains lipase to help digest the fats that are in the milk. Formula may also have those things added. Formula is a protein source, typically either cow's milk or soy. There are some other options, but typically cow's milk or soy, and it has been altered to be digestible by infants. Cow's milk is not an appropriate alternative to human breast milk. The only acceptable alternative to human breast milk for a newborn is commercial iron fortified formula. Colostrum is actually produced before milk, and it is a concentrated source of energy. There's a lot of sugar in it, and it has a lot of immune factors. And it's produced in really small volumes. The newborn stomach is really tiny. On day 1, it's about the size of a marble. Day 3, it's about the size of a ping pong ball. Day 7, it's probably about the size of one of the small Easter eggs, the little plastic Easter eggs. So it doesn't hold a lot at one time. Colostrum is in very small amounts. It's very concentrated energy. It gives them the chance to coordinate that suck and swallow with smaller volumes. And then the more the baby nurses, the more milk is produced. And so once the milk comes in, then they begin to have larger volumes to deal with. Stools, and the initial stool of a newborn is meconium. It looks very thick, black, and tarry. It's sticky. If you see it diluted, it's green. It's actually black because there's so much bilirubin in it. If meconium passage is delayed, the baby can actually start to reabsorb some of that bilirubin that can contribute to jaundice. Once the baby starts to eat, then the stool begins to transition. They start with meconium, and then it's transitional, so it's meconium mixed with regular stool, and then the regular stool differs depending on whether it's breast milk or formula. Breast milk stool is yellow and curdy. It looks a little bit like mustard mixed with cottage cheese. It tends to be much softer, and it's passed more frequently in the first few weeks. Formula stool is usually passed once or twice a day, and it's thicker and can be green to brown. Feeding behavior for newborns, remember their stomach size is really small, so those feedings are small at first, and frequent feedings are normal and common. Newborns may show signs of hunger. Some babies actually take a day or two to start giving us some signs that they're hungry. Some aren't as interested in food and need to really be encouraged in the first couple of days. Some signs of GI problems: if they don't pass meconium within 24 hours, someone needs to be evaluating why. If the abdomen seems to be really full above the umbilicus, then they may have an enlarged liver, hepatomegaly, or they may have duodenal atresia that's preventing the chyme from moving further down the intestine. If the baby is born with abdominal distension at birth, that can be from either an abdominal wall defect, maybe the abdominal wall may not be closed fully, or from a tumor. If a baby is born and their abdomen looks hollow, it's called scaphoid. Listen to their chest. If you hear bowel sounds in their chest, they may also have some respiratory distress. That can mean a hernia in the diaphragm when part of the intestine is actually up in the chest. That's an emergency, so pay really close attention to those things. Fullness below the umbilicus. So if the belly looks full below the umbilicus, the bladder may be distended. If a baby's having diarrhea or excessive gas, they may not be tolerating the formula well. If there's meconium coming through from the vagina or the urinary meatus, they have a congenital defect that needs to be evaluated. Spitting up is normal. Projectile vomiting is not. Okay, spitting up is some milk comes up with a burp usually, or just kind of bubbles out. Vomiting involves force, and that's never normal. So any of those things need to be repeated or reported for further assessment. The next section we're going to talk about is the hepatic system.